Hello, Brady.
Hey,
Thank you so much for joining us today. We're going to give folks a minute to get in here. It is 12 Central Time and 1 Eastern Time. Hello, everyone. We want to thank y'all for joining us. We're just giving everyone a moment to get in here with us. It's lunchtime for folks. We want to make sure we can allow them some time to hop in. Okay. In just one more minute, we'll go ahead and get started. All right. So let's go ahead and we will dive right in. Today, I am so excited to be bringing Brady Maiden, who is the community science manager at the Southern AIDS Coalition. But first, I'll tell you a little bit about myself. My name is Justin Lofton. I am the training manager for the Southern AIDS Coalition. And I want to welcome you all to today's SAC lunch. So the Southern AIDS Coalition's put this particular SAC lunch together, which is an opportunity to discuss HIV stigma and its impact on our communities through one of the Compass Coordinating Centers through Gilead Sciences. And so today we are joined again by a special guest, Brady Maiden, who is SAC's program manager for community science. And in today's discussion, we will delve into a conversation about HIV research in the South, explore diverse forms of stigma, and develop personalized strategies for culturally humble and affirming care in HIV services. So, Brady, before we dive into everything, I got a couple of questions that I'd like to ask you. But first, could you
okay.
share a little bit about yourself with the viewers who are joining us today?
Yeah. Thanks again, Justin. I'm excited to be here with everyone today. Again, my name is Brady Maiden. I'm the Community Science Program Manager here at SAC. And so I'm based in Washington, D.C. I have been in the area for about 7 years now. I'm originally from California, born and raised. I know this is a Southern space, but I got to bring it up everywhere I go. Um, my background is in research, disability employment advocacy, and policy. And so my passion really, and it's also like why we're here today, and the topic is really making sure that community is always centered in everything that we do. And so I'm a firm believer, and it's something I'll hint at later on in the conversation, in the spirit of Ubuntu, which means I am who I am because of who we all are. And so that's really how I approach this work, making sure to lean into communities. And I see someone in the chat shouting out DCA every day.
Let's see here. Oh, we got a lot of good people over here in the chat. Actually, we got folks from Rome, Georgia. I see some Mississippi folks as well. Shout out to y'all, Mississippi folks. I'm from there. I see Houston here, DC as well. So, Brady, one of the things that I love to do when we have these conversations is to kind of personalize who we are and allow the viewers to learn a little bit about us. So, the question I have for you before we move into things is, what is a book that you are currently reading or that you have read that inspires you or evokes something in you?
Ooh, okay. So that's a really, really good one. So I'm gonna give y'all a little tea, tell you a little bit about myself. So I'm currently reading this like smutty, and I mean it's smut, romance novel by Tia Williams called 7 Days in June. And so like the book is really centered on Black authors and talking about their childhood, how they're navigating adulthood, and of course, there's a little, some spicy scenes in between. Just to keep it interesting. So yeah, that's what I'm reading.
Awesome. So thank you for sharing that. I would like the title to that book just in case. And if you want to drop it in the chat for the folks who might be interested, please feel free for us.
Yes.
But that being said, you want to dive right in, have this conversation today about this important information?
Let's do it. Let's do it.
Okay, okay. So I am going to share my screen, you all. Let's see here. Share. All right. So as I previously mentioned, we have a couple of things that we want to touch on today. And so the first thing is we want to understand the significance of community-centered research in HIV treatment and interventions. We want to connect the history of medical mistrust, and this is related to current impacts on the community today. We want to recognize the importance of including the South in HIV research efforts, learning strategies and models for community engagement, and navigating HIV vaccine trials and research as well. I'm going to go ahead and make this a little bit bigger. So, Brady, one of the things that I want to ask you about is, when you look at the work that you are doing, could you define the meaning of community-centered research and how you actually got involved in this?
Yeah, so that's a really great place for us to start. So, community centered research is kind of already in the title, but also it looks at putting the human perspective back into research. So, instead of viewing people as test subjects or random names assigned to clinical trials or even data points, what a community centered approach looks at is making sure that every voice is heard in every step of the research process. And so, this honestly is probably the huge passion of mine, as I hinted at, because as I mentioned earlier, have been in the disability employment advocacy space. So, I was a researcher there. And what was so frustrating for me was constantly seeing people being referred to as data points, not as humans with different lived experiences and socioeconomic backgrounds, and not looking at them as a holistic person, but only seeing them for what they offer to contribute to this research um, trial. And so when I shifted into the HIV space, I was like, we constantly need to make sure that we are bringing community into every step of the way, because research doesn't progress without people. And so we need to make sure we're centering people, their opinions, their ideas, their lived situations, and how we approach this work. And honestly, we don't make progress without community. So that's why I'm here, because I believe that community should always be centered. And that's really how I approach the work.
Mm. And you hit on something that we'll touch on later on, which are, what are some of those strategies and the models and the tools that you're currently using in the space that you're working in, to really hit on some of the HIV science and research pieces, and maybe some of the reasons why folks don't engage, but how we can really shift that narrative and make folks want to be more engaged while respecting their contributions and their bodies in the participation of these research
Absolutely.
of research and science. So that being said, one of the biggest things that I think when we look back at history is that there is a lot of the stigma that we see can be stemmed from medical mistrust. So you're looking at HIV science, and you go back to things like the Tuskegee experiment and things of that nature, scientific studies, and how that began to, in some way, begin to create or shift a narrative among more specifically Black people and creating medical mistrust. And so I don't want to take too much of your umph here, but if you could kind of lay out the history of medical mistrust and its current impact on communities. Like, what are some of the additional historical examples of medical mistrust as well that you've seen?
Yeah. So just before we do that, I kind of wanted to level set. So if you can click to the next slide.
Very
Um,
easy. Let's see here. Is it gonna go? There we go. And it might be a lag there, this
yeah. Let's actually just click two more over. Sorry.
before. Let's see.
There we go. There we go.
Okay.
Okay. So yeah, as we talk about the history and we really level set of like the impact and what's going on and what we're dealing with when we approach these sort of science-based conversations, we kind of need to look at what is medical mistrust. So medical mistrust really refers to the lack of trust, suspicion, and also constant mistreatment that individuals have been interacting with when it comes to healthcare providers, the healthcare system in general, medical treatments, and really medications. And so, as we recognize, this really stems from historical injustices, unethical medical practices, and really harmful acts that have impacted people of color. And so, some of the examples of that is Justin, as you hinted, like we always highlight the US public health study at Tuskegee University. And I frame it that way because a lot of folks have, brought it to our attention that we should reframe the way we look at um, the institution and really looking at who's to blame for the way things have acted. So when we not only just use that as an example, there's so many countless others. So we have Fannie Lou Hamer and Mississippi appendectomies that were happening in the 60s, which was the forced sterilization of Black women in the South without their consent, without their knowledge. Women were literally coming in to engage with their healthcare providers or their doctors on regular information and then were sterilized without their consent. Sorry if there's background noise for folks as well. Another example, and even looking at other populations in marginalized communities, is for indigenous folks. They were their ancestors were forced off their land and placed on reservations with little or no access to health care. And then they were met with discrimination once they received it. So looking at the distrust, the trauma, the pain that's there, why would folks want to interact and engage with providers? And then
Mm,
another example that's really well known is Henrietta Lacks, whose cells were like used to develop many vaccines today, and we'll talk further about vaccines later on, such as like polio, the polio vaccine, HPV vaccines, and even some cancer treatments. It took years for her family to not only get recognition, but also learning the story of how she was unlawfully tested on and then died of cervical cancer is really just hard to hear and bear for folks. And so these are just like countless examples of how medical mistrust within communities of color makes it increasingly difficult for them to even approach or engage in conversations and building relationships with their healthcare providers because they've seen it incorrectly done. They've never seen a healthy dynamic in which healthcare providers understand their patients, they're talking to their patients in a language that they can understand, and they're really working to come together. And so when we enter these spaces, really discussing HIV prevention options such as like PrEP, long acting injectables, and even sharing the ongoing research with folks about HIV vaccines, we really have to be intentional with calling out the history, as I mentioned, and the trauma, because we can't even discuss encouraging someone to put something in their body that they probably have not heard of or are unsure about because they haven't been provided the right information until we address why it's so painful and the trauma and even engaging in these discussions in general.
mm. And thank you for one providing that background, because I think it provides an additional level setting, utilizing that historical context. I think the other thing that I really enjoyed about that is that you mentioned Henrietta Lacks, and I think oftentimes her experience and her family's experience is left out of the conversation because we do think about the Tuskegee syphilis study when we think about the impact or the effects of medical mistrust, and specifically among Black people in general. So thank you for taking the time to break that down for us. So I want to pull just a little bit more on that, because I sort of feel that some of the historical context actually reinforces some of the perpetuated stigma that is related to those living with HIV. So, thinking about that, how do you feel, or how have you seen in the work that you're doing, that this has affected participation in HIV vaccine trials and research?
Oops, I was on mute. But yeah, so um that's such a great question. So we all know that history plays like a huge role in like reinforcing stigma around HIV and even participation in HIV vaccine trials. So take for instance, as you know, we're mentioning the Tuskegee syphilis study. So that kind of medical abuse has led to a history and a legacy of mistrust, especially in marginalized communities. And so this deep-seated mistrust makes people even hesitant to engage in conversations or to go out and look for information or research or even vaccine trials in general. And so then you also layer on the ongoing stigma that people with living with HIV face. And so that's an internal stigma, that's a social stigma, as something we'll mention later on. Actually, we can go back 2 slides so folks can see the different type of stigma. Yeah, there you go. Thank you so much. So yeah, as I mentioned, they're navigating all these different types of stigma before even approaching. So there's that social, there's that public, there's that self, there's perceived. We recognize that HIV has been stigmatized and almost labeled as a person and not a virus that anyone can get, because we all know everyone is HIV possible. And so then there's like, will they be labeled? How is a health practitioner going to like interact with them? So they're going interacting with all these different types of stigma. And so because discrimination and misunderstanding still exist, it kind of creates a breeding ground for misinformation to thrive. And so then there's also the fear of folks being judged or outed, also adds another layer of hesitation. And so with this misinformation and sensationalized stories happening right now, exaggerated narratives and or exaggerated narratives about vaccine trials can really amplify the fears. Um, Even though current research practices are actually being conducted in a safe and ethical way. And so that's why initiatives like our Southern Science Community Education series are so important. So I'll give you an example. So one of our panel discussions that we have with folks is titled Nothing Beats a Failure But a Trial. So this really focuses on the reframing of how we look at vaccine trials. And so seeing them as lessons learned and not failures. So that's already how we shift the narrative. It's like if folks see that like they're not entering spaces where they're just going to be used, or they're going to provide knowledge and nothing's going to happen, or they're constantly seeing that vaccine trials are failing, so why would I even want to sign up if it's not working? So reshifting how folks talk about it and discuss it, but also being able to interact with researchers and scientists in the room and have that discussion is really how we focus on it. And then another example is of like a failed study. So when people hear about trials like the Masako study, and so this was a recent study that was done for same gender loving men in the United States and abroad. And so the study was discontinued. It was quote unquote mentioned as a failure. That really doesn't inspire the type of confidence for someone like you or I, or other folks within the community to just pull up and sign up for a study in their area. And so we try to have these conversations because we know that social and healthcare stigma are active barriers to accurate research and scientists. So it's really about creating a space where people can understand the difference between hot news takes and the real, but also recognize that science is slow and progressive. It's not a quick moving vehicle or for information or for progress or for vaccines. Research and science really move in a slow progressive manner. And so as we continue to call out the stigma and we continue to create spaces where we recognize folks are going to be hesitant, that creates that trust. And so we're being transparent, we're being empathetic of the situation, and that's how we really frame community centered approaches to overcome these barriers and to really move forward.
Thank you for that. So I think what that does, it leads me to the next question that I have for you. And I think this one is more centered around the health literacy piece that is associated with the science and the research and the vaccine trials part of it, and the role that HIV stigma has on it based off of the historical context that has perpetuated, or enhanced stigma in a way. Uh, so, if you could describe for us the impact of HIV stigma on health literacy in HIV vaccine trials and research.
Okay, yeah. So let's just look at this slide again. I'm just going to refer to it one more time,
Mhm.
looking at the examples of stigma within the healthcare system. So folks are navigating either being denied care, perceived as not being able to receive it, not understanding, not having the funding, all the barriers that come with being denied care. Then they're either receiving subpar or substandard care, which is something that I mentioned for our Native and Indigenous communities where they're receiving substandard care on reservations, or folks within the South are receiving substandard care because either they only have one clinic to serve them in the 30 miles, you know what I mean? That's close to like where they live. Like your folks are not going to receive adequate care because there's so many people that need to receive care because there's so little access to clinics in their area. And then it's also the physical or verbal abuse that comes with it. Like you're going to have interactions. Folks have had interactions with researchers, practitioners, and doctors who either talk down to them or don't actually consider them as a human. They're speaking at them, they're judging them for what's going on without recognizing all the other determinants of health that play a role into why they need better care. And so all of that stigma really factors into health literacy. So if I'm having a poor experience with a doctor, why would I want to continue to learn more? Why would I want to continue to put myself in those situations where I'm being mistreated? And so that's where we see a gap and literacy because folks don't feel comfortable and they don't feel safe or trusting of these providers. So they're not going to go and get the information or be receptive to who is giving them the information. So when people feel judged or discriminated against, as I said, they're less likely to seek it out. So one way we're working to really increase health literacy is through our vaccine ambassador program. And so we have partnered with different organizations like the Black AIDS Institute and Treatment Action Group, and we work with social media influencers and content creators to create videos, social media reels, and stuff that debunk a lot of misinformation out there. And these videos are really designed to be relatable, socially relevant, and making the information more accessible and understandable. And the reason why we do this is because there's the message and then there's the messenger. We recognize that there's a gap in health literacy because the people who are providing the message don't look like the community we're serving. They're not engaging directly within the community, and community wants people who look like them, who talk like them, who understand their experiences. And that's how we create sort of that meeting in the middle or bridging of the gap so that folks can increase their health literacy and understanding of what's going on. And so, particularly for folks in the South, they want folks from the South bringing them the information. Also, community shouldn't have to chase after this information. They shouldn't have to chase after the research that is available. So, what we're doing, not only through this program, but just really in our understanding of health literacy and increasing it overall in SAC is bringing this information to community in a vehicle that they'll be receptive to. So that's either we're creating community spaces where they're engaging with folks who look like them and Southern researchers and scientists in their area. They're looking at it on social media where they're seeing different content creators and influencers like viewing their content. Like one goal of mine, and I'll share it with y'all, is like I don't know if you know the influencer Lene. I think it's Lene. She does. I'm gonna keep it black, but I'm gonna keep it brief. Like imagine she's sitting there and having someone at her level talking about, all right, I'm gonna keep it black, but I'm gonna keep it brief. But we need to talk about the fact that Black people aren't participating in research because of medical mistrust. Like, imagine the impact that would make if folks are seeing someone who look like them talk about issues that affect them. And so I really can't emphasize that enough that, like, as we create different methods for folks to receive this information, we're also breaking down stigma. So we're breaking down the social part of stigma, which is how society views these conversations, and recognizing that this is a larger conversation that we all should be having and not just one particular group, and putting the onus on folks in the South to be the only ones having these conversations. And then also, it increases and encourages people to not only go and participate in HIV research, but tell their friends, tell their family members, and really pull up into these spaces because they feel comfortable and because they're welcomed, because we value their experience. We put them first, um, and leaning into what we can do to provide them this information in a way they'll be receptive to. So that's really like how we navigate stigma. And it's hard, it's not easy, but like navigating that and increasing health literacy is like our main goal.
Thank you for that. All nuggets, all gems, mic dropped. That was the mom. I wish I could put like an emoji or a GIF on here and like drop.
Right.
But I think you hit it on the head, and I'll be transparent. When I lived in Nashville, I participated in an HIV vaccine trial study at Vanderbilt University, and it was the AMP study actually. And I was one of the first ones. But what I enjoyed about that experience was that even though the folks were predominantly white and did not look like me, they took the time to engage in community. They didn't just say, "Hey, we just want to put ourselves there." What they did was is they literally found the connections and the relationships with the organizations that were servicing folks from our community. And because that was the gateway, if you build trust with those organizations who are service providers, you can't get access to the people who you need to help really inform. And we see oftentimes, time and time again, that Black people are underrepresented in vaccine trials and research, whether it's PrEP, whether it's anything else. And in order for it to happen, it was the partnerships that made it work. That's how I became a part of that actual vaccine trial study. So I think nothing but gems and nuggets that were dropped in that. And I see in the comments down here, Manisha, she said, so important and a healthcare marketing mistake of not including messengers that look like the audience. Any feedback or response to that, Brady?
No, yes, that is like a huge one. Like, I'm sure you've all seen like recruitment flyers of, and I'm not trying to like call anybody out, but they look like a certain type of people that mimic our palms. And it doesn't represent the community, or there'll be stock photos of folks like being really excited to go sign up for PrEP, or like to meet with their healthcare provider to talk about PrEP, or really excited because they were recruited for a vaccine trial and they received their payment. Like, that's not going to encourage people to show up. It doesn't look like them. They don't know who these people are. This is really just a gimmick to, as we said before, use my body to advance research. And that's trauma. That's a microaggression, if we're being honest, because now you're not only disregarding the trauma that's happened that makes folks uncomfortable, but you're not even adding people who relate or look like Black people, or who look like Black folks from the South, or who look like Latinx folks from the South. You're not creating marketing that makes that. So why would folks be receptive to pulling up? And so that's why when we have our vaccine ambassador program, or when we're engaging in our community education series, we make sure that we bring people in the room that look like the community that we're serving and the audience that we're trying to bring to the table. So yes, definitely a good point.
Spot on. And thank you, Manisha, for that comment. And we got Anthony Gordon that just joined us from Jackson, Mississippi. Thank you for tuning in as well. Share, share, share. So, moving right along here, when you are looking at the South, which is obviously based on the data, folks in the South, Black people specifically, are more disproportionately affected by HIV. or have greater risk of acquiring HIV. And so, if you could share with us the importance of including the South in HIV research efforts.
Yeah, so if you want, if we could skip a few slides, I do
We
have just like one chart to show you all
sure can. Let's see. Just tell me when to start.
right here. So
Oh,
yeah, so this is information that we got from AIDS View in honor of Southern HIV Awareness Day. But as you know, Justin, you had mentioned the South makes up 38% of the United States population, but over half of new HIV diagnoses. So that already should be an alarm system like, okay, something needs to be happening and we need to be doing our recruitment work and we need to be focusing our engagement within the South because they're being overlooked. And so that's the first thing. We need to include the South because they've been overlooked in the conversation, but a majority of HIV diagnosis and HIV lives in the South. And so we also need to see a lot of the unique barriers that people in the South face, such as higher levels of poverty, low education rates, lack of transportation access for folks who are in rural areas, which is completely different for folks who are in urban areas who have a quicker access or who have the transportation to get to a doctor's appointment or to go to the pharmacy to pick up their medication. And so we're like, we need to call out all those barriers and also food insecurities. If we're not making sure that folks are connecting and looking at all the different social determinants of health, why would we even approach the conversation? Because we haven't holistically viewed the landscape of what's going on. And so then centering research efforts in the South can really help to identify and address those barriers, which could also lead to more equitable healthcare solutions. And so our organization really recognizes the importance of it, and which is why we've created a model known as like the Southern Science Model. And so this makes sure that Southerners represent Southerners, which is why we bring Southern researchers, Southern scientists to the table. We're making sure that people in the South are calling out what's going on and why we need to center this conversation. And then through our Southern Science Community Education Series, we're seeing firsthand people light up and engage when they feel heard and seen. As I mentioned before, the South is often overlooked. So when we're bringing these conversations into Southern cities and areas and spaces, you see people light up because now they're being heard. Now we're taking the intentional time to listen to what you have to say to you because you're an expert in your lived experience, to hear those lived experiences, to hear the barriers and the stories that have happened that have affected your ability to interact or engage with providers and even in research. And that's how we weave, how we move forward with increasing participation in clinical trials and really also giving folks trust in the research process. And then, yeah, just to really reiterate, we're also creating accessible prevention. We're creating, sorry, let me backtrack. We're creating different initiatives that call out the need for accessible prevention methods. And so that's through our Vaccine Ambassador program, which I mentioned, but also recognizing that focusing on the South is not just addressing a regional issue. We're contributing to the national and global fight against HIV. And that's what we need to see. It's not just the South versus everyone. It's include the South and watch the change that happens. Watch the progress that happens in research. Watch the increase in representation. Watch how we move forward. We want research to progress. We need to bring the people into the conversation firsthand. And so including the South and including folks within the South and every step of the research process really just helps to make sure that no one is left behind and we're developing solutions that work for all communities because the South is so diverse and it has such a huge landscape. So why not use the South and lean on their expertise to create programs so that it can help all and it can be a national, we can address it nationally. And then oh no, I was gonna highlight some of the questions it looks like.
go ahead.
Okay, so I think Monisha wrote, do you think a factor is that organizations don't put in the budget a marketing consultant who knows these important principles? And then why would folks be receptive to pulling up that part? Oh yeah. See, why would they be accept? Yeah. So Monisha, to address your first question, I don't think it's just the budget, but I also think it's just a lack of understanding. And so a lot of folks don't really know about HIV vaccines, let alone that there are ongoing HIV vaccine trials. So there's a information gap into what folks are hearing and what they're receiving. So when it comes to marketing, you're not allotting money within your budget to diverse the representation within your marketing ads because folks don't know what's going on. Folks aren't hearing about it. And majority of the people who are working on vaccine trials tend to represent in the flyers. So if you only have an increase of, let's say, white same gender loving men or um, black cis women, or if, well, black cis women aren't really represented fairly in research, but say let's just stick with white same gender loving men. If white same gender loving men are the only trial participants that you have, those are the people that are going to be represented in the marketing ads. And so it's a little bit of budget because we're not allocating enough, but it's also the understanding, and folks aren't receiving all the information. A lot of nonprofits aren't being passed down a lot of information about HIV vaccine trials, which is why partners like SAC and other organizations are really trying to increase getting the word out there so folks can allocate and really shift how we focus our marketing efforts. So I hope that answered your question.
Thank you. Thank you for that. So I want to go ahead and move right along to our next question that we have for you. And so basically, now you've laid the foundation to talk about, you know, what medical mistrust is. You laid the foundation talking about the historical context. You laid the foundation talking about how the historical context perpetuates stigma related to HIV. You even went into even more information talking about how that perpetuation of that stigma from the historical context has impacted the participation of folks in HIV research and trial studies. I'd like for you to now tell us a little bit more about what are some of the strategies and the models that you're seeing and that you're using in your work that are needed for more community engagement in navigating HIV vaccine trials and research.
Yeah, so there's a lot. If I think I have it on the slide, so if you can click,
Let's see.
um,
You can.
yeah. So yeah, here we go. So how do we? Yeah, that last one. How do we replicate? So one more. Yeah. So really looking at different strategies and models that we've come across. This has really been in lessons learned. So our community science program here at SAC is really evolving and growing based on the information we receive from events. And so a lot of the strategies that I've seen so far is one, pay attention to your community's preferences regarding vaccine and science-based discussions. And so it's really looking at the group. If folks aren't even comfortable talking about conversations that they've had with doctors, if they are still mistrusting, if they haven't even seen a healthcare provider or been to a pharmacy or anything within like a few years or a long period of time, you don't start the conversation with vaccines and science. You don't bring that information because you already recognize that they're not going to be receptive because they're not even comfortable and trusting of healthcare providers in general. So that's how you level set. So let's have an open conversation of what are things that you've heard your family and your friends say about vaccines? What are things that you've heard your family and friends say about doctors and healthcare providers? And so we level set the conversation, getting folks to just feel comfortable talking about their experiences. And then you move into talking about vaccines and being like, okay, well, do you know what a vaccine is? Do you know what it does when it enters your body? What was your experience with the COVID-19 vaccine? Like, adding that layer is how you really pay attention to how your community reacts and is receptive to this conversation. Next is gathering surveys and feedback for insights. Not everyone's going to vocally speak up about what's going on and what's affecting them and how we can change programming or how we can increase awareness about what's going on in regards to research, science, and vaccines. And so that's why you're sending out surveys, giving folks the opportunity to really go into depth about their experience. How did they experience with the program and the event that we had? Also, just their experience in general, giving them multiple platforms. So we are reinstating that we want you involved in every step of the process, and we're going to hear you every step of the way, whether it's written down, whether it's presented vocally, whatever. And then the next one is adjust continuously. So the world evolves daily, and so should our programs. Something that worked 30 years ago is probably not going to work now. There's different vehicles, there's different methods. And it's like looking at the landscape and the area that you're in and adjusting your programming and involving your programming really to fit the needs of the community you're serving. If folks want to be on Instagram and that's how they receive the information, then you should be partnering with organizations so you can be putting out social media reels that you can be posting on social media because that's what they want. And so we should be adapting our programming to meet the needs of the community we serve. If they want to hop on webinars or have sack lunch discussions like this, bring them to that. Partner with organizations that are doing the work. Spread the word. Like we should be evolving because people are evolving, and we need research to do the same. The next one is really employ innovation and creativity and agenda planning. Every idea counts, especially if it serves your community's needs. And I think it's just this idea that when you come to idea creation, don't throw anything out because while it might not apply to this program, it could work for something else, it could work for another area. If you don't have the capacity, that's where you're building networks, you're engaging with different organizations in your area to be like, hey, I have this idea, but I don't have the capacity and I know you do. Let's team up, let's partner, let's talk about it. And then next is really that leads into fostering partnerships to strengthen your initiatives. We're not going to do this work on our own. We are not solely going to address the HIV epidemic and end it by ourselves. So we should be creating partnerships. We should be talking to people. And it also doesn't have to be just folks within HIV Inc. One of the beautiful things that I've seen with one of our Southern Science Community Education series was we were in Atlanta and we had a bilingual space and we were really just partnering with English and Spanish speakers. And one of the women that participated in the event, she was just like, hey, I know they're not like HIV based, but I have this like women's organization. It's an empowerment organization that focuses on young women and also like aging and adult women, and like they could really use this information. It's not even just like talking to them about science, but empowering folks to have agency to speak up for themselves. It's your body, it's your choice, but also you should be empowered to navigate these conversations. And so that was like, oh my gosh, this would be a great space to partner with you, to connect with you, because we want, cis women to be in research anyway. What better way than to use a different method and a different approach to get the message out there? And then also accurate representation. People from the South want to talk to people from the South. Black people want to see Black people. We want to see us represented in the research. We want to see us represented in the conversations and leading the conversations. And that's just really reiterating the messenger versus the message. You can have the message all you want, but we need to make sure that we're providing accurate messengers. So we're making sure folks feel comfortable and safe when having these conversations. And I would say those are really just methods that you can apply to all of your programming and really just approaching conversations in general about science and research.
Thank you for that. And before we wrap up, and I think there's some questions down here as well that I want you to get to. You gave us the strategies and some models that we can use, but what is the risk that we take if we continue to have underrepresentation of Black and Brown people, of the most disproportionately affected communities? What is the risk that we're going to take by not having them a part of HIV vaccine trials and research?
Yeah, the risk we take.
I kind of threw this one just out there because I know we didn't plan for it, but just off the top of the dome, like I'd like to know that.
No, yeah, the risk we take is one, as I mentioned, lack of representation in research, but we're not going to progress. If we, for an example, an HIV vaccine, hold on one second, I think. Okay. Can folks see me? Sorry, it looks like my computer just stopped. They don't want me to talk about the risk.
Yeah, I see. It's not or anything.
Okay, perfect. Okay, so yeah, so one of the things is the risk we take is we're not having representative data. We're not going to have everyone involved in the conversation. So not everyone is going to be able to receive a vaccine once it's available. So I don't know if a lot of folks remember the COVID-19 vaccination conversation about herd immunity or crowd immunity. This idea that if, let's just say you're in a city and only 30 people in your area are vaccinated, the other 3,000 still have the ability to continue to transmit and acquire the virus. So, in order for us to really effectively um, kind of like stop or halt the transmission of a virus, we need to make sure that everyone is vaccinated, that a majority of the population is vaccinated. Well, how do you expect to the majority of the population to be vaccinated if you didn't include them in conversations? If you didn't bring them on to clinical trials, if you didn't prepare them for the possibility of what an HIV vaccine could do for community. And that's really just, in my opinion, a lot of the hesitancy that came when even the COVID-19 vaccine um, was available and being pushed out. A lot of folks were like, hey, I don't know what's going on. I wasn't involved in the process. I'm already nervous and worried. I'm in the house. It's a pandemic. Like, what is going on? And the reason why it took so long is because folks are mistrusting. They don't want to do this. It's like, why are you like asking me to put something in my body that you haven't created the space for me to understand what it does and what it could possibly do? And so that's really the risk we take. We don't end the HIV epidemic if not everyone is included. So we can have a vaccine all we want, but if everyone is not brought to the table, we're not going to end this epidemic and we're not going to progress.
Thank you for that. And I see the chat is just popping. I love to see the engagement and the dialogue back and forth. So if you want to dive over, if you see something you want to respond to, go ahead and then we'll get ready to wrap it up and open up for any other questions that folks might have as well.
Yeah. Anthony put, I'm from Mississippi, and I think we need mental health as well as HIV testing. Absolutely. The reason being is that some people don't want to know their status or are not willing to take on the responsibility of taking one pill a day to treat or prevent. Yes. And so, Anthony, I'll add to that point is we need to layer it. And that's kind of what I meant by paying attention to your community preferences. So if they're not ready to have a conversation about a vaccine, because we can't even have the conversation about PrEP. So I'm not even comfortable taking one pill a day. Now you're telling me that I would have to potentially take a vaccine that I would take every 6 months and not understand what's going on in my body. And I'm already stressed and there's already other factors happening in my life. Then that's where it's like you call out and let's address the mental health. Let's address the stress. Let's address the trauma, the pain, and also the stigma that comes with having to take a pill or having to have these conversations. Then we make sure that people are in a healing space to be receptive to the next level of conversation.
Hmm.
Um, and then, yeah, Monisha put, it's not really the responsibility of PrEP, but it's the related to inadequate health campaigns. There's a lot of inadequate health campaigns. There's not a lot of health literacy happening to get folks to really understand what these campaigns mean and what the effects are. And so that's why we create these community spaces to make sure that, okay, you saw this marketing ad and it's not doing it for you. You're not about it. But here I am, me, Brady, and I recognize what's going on. I've been involved in the process. Let me actually tell you my experience, my story, and what I know. And let me put you in the room with people that look like you to really help get this conversation going so you feel more comfortable, so we can talk about the possibility of you getting on PrEP, so we can talk about what a long acting injectable is and what that could do for you. And then we'll bridge the conversation to talking about research and science.
Mm.
So yeah, y'all are going in.
I love it.
I mean, Anthony, Monisha, looks like y'all might have to have y'all own. See, this is what I mean, creating partnerships. Y'all fostering partnerships in the chat. I really do hope y'all link up because this is great. But yeah, y'all are saying great things. And I really do hope we see an increase in representative campaigns.
Link up on LinkedIn.
That's
But I think this has been really awesome. Even though I've been doing this work for a while, I think today you dropped so much information and knowledge on me. So I can only imagine what some of the other folks who are participating and watching from their respective spaces have gotten from just, it was just knowledge Latin. So thank you for that. That being said, I just want to know what else you have for the people who want to hear. Where can they find resources? Where can they connect with you and engage with you? How can they participate in whatever you're doing? Let them know.
Yes. So I really just want to plug SAC's Instagram and social media at is Southern AIDS Coalition. I know someone earlier mentioned in the chat where the videos if they can see. One of our vaccine ambassadors, her name is Simi. She has done a lot of great work with encouraging folks to really just navigate what does it mean to sign up for a trial, what does that process look like, and she even walks you through it. So definitely check out our Instagram and social media pages, also our YouTube page. We and then also on social media as well, we have community conversations, and these are us really polling. We polled a lot of our community members to get their feedback on what are questions that you want to ask a researcher or scientist that you don't feel comfortable asking in a larger group setting. And so we partner with different vaccine research clinics. So, like the Vanderbilt HIV Vaccine Research Clinic, to name one, and they'll answer those questions directly for you and point you to resources so that you can hear about what's going on. So, I would definitely encourage you to check out those two areas. And then I will also drop my email in the chat. I'm a friendly person. I'm a little awkward, but please reach out, connect with me. If I don't have the information or if I don't have the programming, I will gladly connect you to someone that will. I meant it. I'm really about it. And then, Justin, if you could click to the very last slide.
Let's see here.
Yeah, and then I really just want to iterate the last point. I mentioned it early on, but I'm a firm believer in the power of Ubuntu. And it really means is I am who I am because of who we all are. And so I really believe that as we continue to have these conversations, as we continue to grow, let's make sure that we're doing it in the best interest of communities. If community is good, then we're good and we grow together. So I really just want to reiterate that, encourage you all, but check out those different resources and please reach out. I would love to connect.
And thank you so much, Brady, for everything you provided to us today. One of the things I want to note is we are extremely grateful for Gilead Sciences because they, on this end, help us to make the SAC Lunch Series possible through their funding and their ongoing support. Uh, at SAC, we are one of their 4 coordinating centers, and our focus is on stigma reduction. And so, in addition to the work that Brady is doing in the community science space, we also have a variety of other stigma related trainings as well that are free to those organizations who feel that they could benefit from it. We do a deep dive into HIV and stigma. We do a deep dive into cultural humility, the identity strategies and dynamics that exist there. And we are currently working on some other trainings as well at this time. And so those are free. You can go and apply for those online by visiting the Gilead website or the SAC website. And we are extremely excited to provide those offerings. I see you all dropping your emails in the chat. I know that Brady has dropped hers. I have dropped mine if you are interested in any of those additional trainings. And we look forward to connecting with you all next month on the fourth Wednesday. And so if you have any questions, reach out to us. But for now, Brady, thank you. And if you will stay on after this, but to everyone else, have a great rest of your day and enjoy the rest of your lunch.
Thank y'all so much. We hopping on and we about to pop off in LinkedIn. I'm ready to connect.